Hello, myself Anu Shrikant, a rheumatology resident from Cochin, Kerala. I am here to present before you the results of our study, which is actually a collaborative effort of 3 separate rheumatology centers across India, Cochin, Lucknow, and Bhubaneswar, and this was selected to be presented for the EULA 2022. Methotrexate is a very important medication used for managing rheumatological conditions like rheumatoid arthritis, psoriatic arthritis. The most commonly used COVID vaccine in India is a COVISHIELD, administered as 2 separate doses at least 12 weeks apart. Methotrexate is known to affect the vaccine response or the protective antibody levels. However, holding methotrexate will also lead to worsening of the disease. So the questions which came to our minds were, does holding methotrexate improve the vaccine response? And should methotrexate be withheld after both doses of vaccine or only after the second dose of the vaccine? We studied patients with rheumatoid arthritis or psoriatic arthritis on methotrexate, and we devised 2 separate studies, namely the MIVAC-1 and the MIVAC-2. In MIVAC-1, the medication was withheld after both doses of COVISHIELD, whereas in MIVAC-2, we withheld the medication only after second dose of the COVISHIELD. In each of the studies, the patients were divided into methotrexate hold and methotrexate continue groups, respectively, each having around 70 to 80 patients. And we tried to study the outcomes, namely the protective antibody response after second dose of the vaccine. And also we looked into any disease worsening in terms of flare percentage after holding the medication. In this picture, this is a graph showing the antibody levels and the groups in both the trials. It is very clear that the green and the purple has higher antibody level compared to the pink and the blue. So the green and the purple represents the antibody levels in the methotrexate hold group of the first and the second trial, respectively. So it's very clear that on holding the medication, the antibody level is clearly higher compared to continuing the medication during vaccine. Now, we try to see the flare or the worsening percentage when we withheld the medications in both the trials. In the first trial, when we withheld medication during both doses of vaccine, around 1/3 of patients flared, compared to the second hold group, when only 11.84% flared. So it's clear that holding methotrexate after both doses or only after second dose of the vaccine yields higher protective antibody titers compared to continuing the medication. And it is safer to hold methotrexate only after second dose of the vaccine compared to holding after both doses of the vaccine, since the disease worsening rate is lesser. So though we got the results like this based on both the studies, it's always safer and best to consult your own respective rheumatologist before taking decision regarding holding or continuing methotrexate during COVID-19 vaccination. Thank you.